vaginal infections, and today's topic is going to be about the connection between pelvic floor dysfunction and recurrent vaginal infections. So, for those who do not know me yet, I have dealt with two separate episodes of 2 year long recurrent vaginal infections, and I've healed myself naturally using nutrition and subconscious reprogramming and mindset work. So that's what my whole entire page is about, and that's what I help with in my program. And I choose topics based on what I'm seeing my clients need, what I'm seeing my audience needs, or what I'm going through in the moment. And right now, since I have healed my recurring vaginal infections, I've noticed a lot of fear coming up for me around intimacy, and also just the fear of being reinfected again with recurrent vaginal infection. So if you deal with this anxiety of getting reinfected and dealing with that again, I do have a video on how your fear and anxiety is manifesting your vaginal infections. I also do have a video on nervous system dysregulation when it comes to recurring vaginal infections. So before we get into this, I'm not a pelvic floor therapist. I'm a dietitian. I'm just giving basic pelvic floor knowledge so you guys can understand that sometimes you may think you have a vaginal infection, but it really may be pelvic floor dysfunction. I'm going to go over the reason for that. So we're going to be talking about the connection between pelvic floor dysfunction and recurring vaginal infections and how this impacts intimacy after healing. So what is pelvic floor dysfunction? So first I want to explain the pelvic floor muscles. So these muscles support your bladder, your uterus, your vagina, and your rectum. And dysfunction can look like if it's too tight, which means that it's hypertonic, or too weak, which means that it's hypotonic. So if it's too tight, I'm pretty sure that is most likely like vaginismus. And then too weak would be, I'm sure, after like childbirth or something like that. So common symptoms of pelvic floor dysfunction looks like pain during sex, which is the same as recurring vaginal infections, a burning sensation, which is the same symptom as recurring vaginal infections, incomplete emptying of bladder, constipation, and sometimes higher risk of infections. So the burning is really important to realize that if you experience burning during sex, it may not be a vaginal infection, it may be pelvic floor dysfunction. If you want to know whether it is or not, you have to go see a pelvic floor therapist. My favorite is the vagina rehab doctor. I've been following her for a few years now. I listen to her podcast. I love her Instagram page. She's a great tool for all of this. So you'll learn more about these things from her page. But I bring this up because during intimacy, I have felt burning, and it scared me thinking I had another infection, and it caused me to go into a spiral and a loop of, oh my gosh, I'm reinfected again, like, and all this like downward spiral, just negative thoughts. So it's really important to know that burning does not always mean you have an infection. It can literally mean that you have tight pelvic floor muscles. So how pelvic floor dysfunction connects to vaginal infection. So chronic tension or spasms reduces blood flow, which then makes your tissues become more fragile, less lubricated, and more prone to micro tears, which makes it an easier entry for pathogens. So when you are anxious during intimacy or before having sex or during sex, your pelvic floor muscles can contract. So this allows for reduced blood flow, and we know that during sex we want more blood flow, so the area to be more aroused, more lubricated, and more erected. But if there's reduced blood flow, then it's less lubricated, you can be aroused, but it's less lubricated, and the tissues can become more fragile. So it's easier for it to be more irritable. And this makes you more prone to micro tears, which also makes it easier for pathogens to enter and cause recurring vaginal infections. So having pelvic floor dysfunction can directly lead to recurring vaginal infections, but it can also be a side effect of after healing recurring vaginal infections, because you may have a fear that if you have sex, you'll get a yeast infection or a BV, and that will cause you to tighten up during sex, and then that can cause what I just talked about here. Poor pelvic floor coordination can also mean incomplete bladder emptying, which puts you at a higher risk for UTI. So with this, obviously if your pelvic floor is not coordinated the way it's supposed to, then you will not be emptying your bladder as you should, and then that can cause UTIs. Hypertonic pelvic floor, which is when it's too tight, can mimic or worsen vaginismus, making sex painful. And if sex is painful, you'll experience fear and avoidance, and that stress cycle in itself can suppress your immunity. So this is currently what I'm working through right now, because I don't have vaginismus, but I do feel myself being more hypertonic, like more clenched because I'm anxious around getting another infection, which makes sex painful. So it does cause burning and irritation, which is why you would think you have another infection, but in reality you don't. Your pelvic floor muscles are just tight. And the fear and the avoidance and all of that, especially if you're in a relationship, that chronic stress can suppress your immunity because, as we all know already, stress suppresses your immune system. That can cause more infections. So I've had women tell me that they're not intimate with their husbands, and this is causing stress in their relationships. And chronic stress over time will lead to you getting more infections and will also lead to just suppressed immunity overall. I'm like sweating a lot today, honestly, guys. It's really hot. So, yeah. And then weak pelvic floor may cause may cause poor support. So this can lead to changes in vaginal pH and microbiome balance. So this is all the ways in which your pelvic floor can basically connect to vaginal infections. So if you resonate with any of these, definitely comment down below or let me know. But it's not always an infection. It can just be pelvic floor dysfunction. So now we're going to talk about fear of intimacy after healing. So many women feel nervous about having sex again after healing from infection, which is obvious because if you spent all this time dealing with it for years and you finally healed, you would absolutely do everything to avoid being reinfected. And so this is about finding trust and safety in your body again, because your body knows how to heal and how to stay healed, but you have to do the daily work to regulate your nervous system and to trust that it's going to stay healed. So this is what I'm currently working through now, which is why I'm able to give this advice. So it's really about building back that trust, because if you don't trust your vagina to heal, it's not going to heal because you're not giving it any support to heal. So it's also about the fear of pain, the fear of smell and discharge, or the fear of triggering another infection, which can create pelvic floor tightening subconsciously. So, and this is also what I told you I experienced. So because you're scared of being reinfected, or you're scared that your pH may be off balance or something, then you don't want the person to smell something or see weird discharge. So naturally you tighten up, you don't feel as open and as loose as you should, because you're so in your head worried about getting another infection or whether something is wrong down there, when in reality nothing is wrong down there at all. Your nervous system is just so used to preparing for pain and preparing for infection that it's bracing yourself for that, and that can cause your pelvic floor to contract, and then that can cause the pain during sex. So the fear itself can be what's causing the burning and pain. So it may not even be an infection. It also may not even be your pelvic floor muscle. It can literally be the pain, because your brain has, I forget what it's called, but your brain basically remembers fear and will brace you for it. So it makes the body believe that something is wrong even if there's no infection. So you can feel pain just from, I think it's called trauma memory, and you may not even have an infection at all, or you may not even have issues with your pelvic floor, which is really important to know. So this is like the placebo effect, because what we assume and think is what's going to become our reality, right? So sorry guys, it's so hot today. So it's really, really important that you are recognizing this and you're not going into a downward spiral thinking that you have another infection, when in reality it can just be your fear that you're feeling. And then emotional trauma from years of infections can linger in your nervous system, and that can cause intimacy anxiety. So because your nervous system has equated sex equals pain, sex equals discomfort, sex equals dangerous, because we knew that before having sex would lead to pain, discomfort, irritation, infections, your body doesn't have a positive association between sex and pleasure. So it makes sex a more painful, less enjoyable experience. So you have to train your body to believe that sex is pleasure, pleasure is your birthright, and that you are capable of having pleasurable sex, and it doesn't have to be painful, that this is just temporary. Your body is just wanting to heal, and it's trying to show you and how to heal, and teaching you how to have patience and to trust in your body's ability to heal. So that is extremely, extremely, extremely important to realize. So make sure that if you are being intimate with a trusting partner who's also very caring and patient, because if you're with the wrong person, this is going to make you feel 10 times worse, because you're going to be dealing with a lot of anxiety. You may feel pressured to have sex even if you don't want to. You may feel like because you don't have sex, they're not going to stay with you. And if that's the case, then that is also some internal work that you need to do, some self-concept work, because your worth is more than just sex. you have a lot to offer because you are perfect as you are, and you have a lot of value to you. So sex does not make you more valuable um, or less valuable. It's a matter of who you are as a person. So it's really, really, really important that when you are dealing with this, you take the time to pause and reflect and ask yourself, what is this teaching me? What can I learn from this? Versus you just going to a spiral of, my body is broken, or my body hates me, or I can't trust myself to heal. And you also want to identify what is the root cause. And the root cause usually is the fact that you don't trust yourself to heal at all. I know with me, growing up, I had really, really bad health anxiety. So I always thought something was wrong with me. Like literally in 6th grade, I thought I had esophageal cancer because I had a sore throat. Like, I would always think something is wrong with me. And as we know, whatever we assume is going to be a reality. So things were always wrong with me. Like I was having chronic acne, hidradenitis, painful periods, just random minor health conditions that were not necessary, but it was happening because I was always in a state of something is wrong with me. And because your brain's job is to prove you right, if my dominant thought in my subconscious that something is always wrong with me, I'm always going to have something wrong with me. So when it comes to health anxiety, you really have to get to the root core of what's causing it and rewrite it. Otherwise, you're going to continue dealing with a cycle of recurring vaginal infections and other chronic health conditions as well. So when it comes to healing this, like the pelvic floor dysfunction with the recurring vaginal infections, for one, you want to see a pelvic floor therapist, and two, in combination with a dietitian like myself who focuses on vaginal health and nutrition, because both together play a really, really important role in your overall sexual health. If you fear intimacy with your husband or with your boyfriend and it's ruining your relationship, you will benefit from seeing a pelvic floor therapist and a dietitian like me who focuses on vaginal health. I forgot something else to say and I forgot. But overall, you basically need to train your nervous system to associate sex with pleasure and that you are safe no matter what. And only be intimate with a partner that you can trust and that makes you feel safe. Because otherwise, you're not going to feel safe. You're not going to open up. So some tools for healing support, for mind-body support, is one, meditation. So on my channel, I have several vaginal healing meditations. Like I have a meditation for helping you to be aroused and showing you the mind-body connection that you can use your mind to lubricate yourself. So I have one for vaginal lubrication. I have one for fear of sex after healing. I have one for visualizing you having a healthy vagina. I have a few for nervous system regulation around vaginal health. So meditation is going to help you significantly because it's going to train your brain to associate sex with pleasure and not sex with pain. And the way to rewire your brain is the repetition of new thoughts and beliefs and new visualizations. So you want to visualize pain-free sex. You want to visualize yourself being lubricated. You want to visualize having no health conditions and just being a normal person that has good vaginal health. So meditations are going to help with that significantly, and I have them on my channel. They're all 5 minutes long. I also have subliminals for vaginal health. So I have a general vaginal health subliminal. I have one for trusting in your body to heal, to stay healed. Because like I told you guys, if you have a dominant belief that you don't trust your body to heal, you are never going to heal anything. It's always going to come back or something else new would pop up. So I have a subliminal for having trust in your body to heal and to stay healed. And I also have a subliminal to help increase vaginal lubrication if you deal with vaginal dryness. If you deal with pelvic floor tension, I have a subliminal for that as well. So these subliminals are basically audio recordings that pump affirmations into your subconscious mind to help rewire it without you having to do anything. So definitely go ahead and check those out. I also recommend practicing breathwork and visualization, both of which I have in my meditations already. So breathwork helps to activate your parasympathetic nervous system, which is the rest and digest nervous system. And in that nervous system state is the state in which you can heal. You cannot heal when you're in sympathetic fight or flight mode. And on top of that, when you're in parasympathetic state, you're more relaxed, you're more able to be aroused, and your pelvic floor muscles are able to be more open, which can allow for pleasurable intimacy without pain, without constriction, and without burning sensations. So it helps to relax your pelvic floor muscles and send signals of safety to the body. And visualization, imagination creates reality. So whatever you visualize over and over and over again is going to become your reality. So instead of you visualizing yourself having an infection and having painful sex, visualize yourself being infection-free, staying infection-free, and also having painless, pleasurable sex. So my meditations incorporate all of that. It has breathwork and visualizations. And just throughout the day, just visualize yourself having pain-free sex. Visualize yourself just living your life with no infection. How would that look like for you? Like, what would you wear? What would you do? Like, just keep supporting your mind with that. It's a lot of mindset work when it comes to this. When it comes to health anxiety, it's really, 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 really about mindset work, because your mind is going to make you think something is wrong with you. It's going to cause you to panic. It's going to cause you to spiral because the mind is rooted in survival. It wants you to survive and it's trying to protect you. So it's going to make you overthink. It's going to make you spiral. It's going to make you panic. It's going to make you hypervigilant of your symptoms. One thing I'm working on is the hypervigilance. Like, stop checking myself to see if I smell, or stop looking for discharge, because whatever you seek, you're going to find. And because it's whatever your brain's job is, whatever you focus on is for it to expand and to grow because of the subconscious mind. So stop focusing on things that are not existent and things that are not there. Focus on what you want. Affirm to yourself, say that I'm healthy, my vagina is healthy, it's always healed and it knows how to stay healed. Use ChatGPT also. Use ChatGPT to come up with affirmations for you, for rampages for you, and just keep saturating your mind with the idea that you are healthy no matter what and that you've always had pain-free sex. And so it's really, really important that you do the mind work. The mindset work is more important than even the nutritional work, because your mind controls everything. So if you consistently train your mind to believe something or to do something, it's going to do it naturally without you having to do anything. This is how people are able to heal themselves from cancer and paralysis and other like random things that people think are incurable, but they're really not. So it's really, really, really important. If you want to support yourself through other practical tips, of course, staying hydrated is really, really, really important for vaginal lubrication, and for sex in general. So making sure that you're drinking half your body weight in fluid ounces, unless you're on, of course, a food restriction. Also, omega-3s for lubrication and tissue healing. So after recurring vaginal infections, your tissues may be inflamed and may feel very irritable. So you may experience more dryness during sex. You may experience just not it burning it, not feeling great, because if you've had inflammation on the tissue for so long, once it heals, you can't just expect, you can't just expect, but most people can't just expect to just get back into sex and it feels good, because the tissues have to heal. Like, imagine you had an unhealed cut for like 2 years, and then it's starting to heal. The area still may feel tender and sore. So you have to really, really, really hydrate with water, coconut water, electrolyte water, mineral water, fresh cold-pressed juices, water-rich fruits and vegetables, bone broth, to help build back up your vaginal tissue to be strong and basically supple again, so that you're not dealing with the vaginal dryness and irritation and dealing with the micro tears. So staying hydrated, as well as omega-3, because omega-3s are healthy fats that help with lubrication. So fish oil, omega-3 supplements, flaxseed oil, vitamin E, like things like that. It's going to help you with the vaginal lubrication, as well as sea buckthorn oil can also help as well. Eating your healthy fats through nuts, seeds, olive oil, avocados, pasture-raised eggs, fatty fish. These are all going to help keep you lubricated and moisturized on them. Gentle pelvic floor stretches. So you can either go on YouTube and look for a pelvic floor yoga video, or follow the Vagina Rehab Doctor. She always posts free pelvic floor stretches that you can do, that I also do, and she offers like courses and books and things like that. So she's a great resource. I follow her free videos on Instagram of stretches to do every day, but some stretches can look like child's pose and yoga. Also some hip openers to release tension. So women store trauma in their hips. It's really important that you're doing hip openers and pelvic floor yoga videos or pelvic floor stretches to help you break the cycle of the pelvic floor dysfunction when you're healing from recurring vaginal infections. You also have to reframe intimacy. Focus first on non-penetrative touch and building safety and trust again. So just take a break from sex in general. Just focus on building back the trust within yourself. And oh my gosh, I'm literally sweating. Focus on building the trust back within yourself, and focus on non-intimate things. So if you have a partner, focus on going on a walk or just doing other things that don't revolve so much around sex, and just focus on your healing. Focus on regaining trust back in yourself. Focus on your self-concept, because you may feel like something is wrong with you, like your body is broken and you're ashamed and you feel guilty. I have a meditation also on releasing fear and shame when it comes to this, because I also was dealing with feeling guilt and shame around thinking that my body is broken and it's not working the way it's supposed to. And in reality, your body's not broken, it's healing. And that's just one mindset shift away. You can choose to focus on that your body is broken, or you can choose to see it as my body is healing. Right now, I'm feeling these symptoms because my body is healing and it wants to heal, and it's trying to tell me what I need to do or what's going on for me to heal. So put your attention where you want it to be so that it can continue to grow that way. And you really, really, really have to layer in the nervous system regulation daily. EFT tapping, affirmation, meditation, all of these to help you with regulating your nervous system, because if your body does not feel safe, you're not going to feel safe having sex. So you have to regulate your nervous system and affirm to yourself that you are safe, so your body can relax, get into that parasympathetic state, and open up so you can have pleasurable sex without experiencing burning and also fear of discharge or odor if you're doing oral sex or anything like that. You really have to regulate your nervous system. This is so important. I have a whole entire video here on, like I told you, nervous system regulation, also dealing with fear and anxiety when you want to be intimate, or just in general when you're dealing with recurring vaginal infections. So with that being said, that pretty much concludes everything. The meditations and subliminals are on my YouTube channel. If you need more one-to-one support with your nutrition, join the Vag Reset program. I give you a one-to-one protocol for nutrition and manifestation plan. We also go over sleep, nervous system regulation, stress management, mindset, and you get basically one-to-one support for me for like a month to help you with everything that you need to know in order to help you heal permanently from your recurring vaginal infections. If you need my pelvic floor support, see a pelvic floor therapist, and just utilize all of my education and free tools to help you heal, because even if you don't work with me, you can still heal based off of what I teach you guys on my page. I also do have a Vag Reset ebook that goes over information on how to heal from your recurring vaginal infections as well. So I don't think I'm forgetting anything, but that's pretty much it for today's video. Stay tuned for the next video, and I will see you guys all next time. Bye, everyone.